So, the first question I would like to pose to Dr. Quimby is one that was actually asked by a couple of members of our audience, hence why there are two questions up on the screen here. But it is, which section of the brain does mirtazapine affect, slash, how does mirtazapine work?
Yeah, it's a great question. It's actually a really fascinating drug from the standpoint of its mechanism of action. And I'd have to say that, what we know about the medication is that it affects both 5-HT2 and 5-HT3 receptors, again, centrally in the brain, and usually in the chemoreceptor trigger zone of the brain, which is important because that's the part of the brain that senses a lot of toxins in the body. Then also H1 receptors, it's an inhibitor of H1 receptors, and both of those mechanisms are thought to be related to its orexigenic effects and the ability to then intake more calories and have that weight gain. So for that reason, there's multiple different ways that it's addressing the problem and kind of covering various receptors centrally in the brain.
So, is there anything we should be looking out for on the bloods? Are there any specific changes in blood values we should expect when using mirtazapine in our feline patients?
Yeah, so in our experience, the medication does seem to be very well tolerated from the standpoint of blood work. Very rarely, liver enzyme elevation can be seen, usually ALT elevation, and this is it's rare enough, honestly, that I can only think of 2 or 3 cases in the time that I've been using it, really, where we've seen this happen. But if you should have a cat that had liver enzyme elevation and they go up, I guess you would have to consider it. Or if they've never had liver enzyme elevation and then you're seeing that ALT elevation, that could actually be from the medication. But like I mentioned, we very, very uncommonly see that.
Okay, so I presume this is a question that has been asked from the standpoint of human use of mirtazapine, but in your experience with cats, have you seen any issues with addiction or withdrawal symptoms when you've stopped the medication at all?
Yeah, interesting question. I don't think that I have perceived anything using this medication, really transdermally or orally, to make us have a concern here. I think the biggest thing to consider would be that if we do stop the medication, we need to reassess that patient and make sure that they are holding their weight, that they are still eating enough calories, because that's usually the concern is if they're no longer getting the medication, they may actually need to start it again. So that's where your evaluation as a clinician becomes really important. And I don't think that I would call that a symptom of withdrawal. That's a little bit different way of approaching the problem. I've never seen anything that I thought was concerning for addiction or withdrawal.
So many of your studies, and certainly ones that you touched upon in the webinar, have given a dose rate for oral mirtazapine of every 2 days, or certainly not necessarily daily. Yet the dosing regime for Mirataz is daily application. So could you explain a little bit the reasonings behind that?
Yeah, I think that question goes directly to the pharmacokinetics that are a little bit different between the oral medication and the transdermal. And when you have oral administration, you do get a higher peak in the serum concentration. So therefore, the body does need a little bit more time to process that, and we seem to see more side effects associated with that. So and in a young, healthy animal, we just discovered that you could give oral mirtazapine daily, but almost none of our patients are young and healthy that we would be giving them this medication. So it was never really applicable. And then when we got to studying oral mirtazapine in older cats, they typically had kidney disease, something like that, that delayed the pharmacokinetics of the drug or delayed the elimination. So again, because of those higher serum concentrations and those other diseases, we needed to decrease the timing of the dose. But we don't really see that with transdermal because the serum concentration is not as high, and it does really cycle out of the body more quickly at that lower, more steady serum concentration. So very commonly, we don't see any issues at all when we're administering it daily to our patients.
Perfect. And I would add to that from a DECRA perspective that there have been some further oral presentations on the use specifically in the subset of cats that had renal disease within our pivotal field trial. So if anybody would like further information on that, they are more than welcome to get in touch with us, and we can provide them with that as well. So very much mirroring exactly what you have just said then, which is great. So how many days after Mirataz administration have you registered some effect of the product itself?
And well, I guess I feel like it's an interesting question because I wouldn't necessarily think that the effect of the medication would continue. So again, that probably relates to why daily dosing is necessary in our patients. I don't, even if I gave, not that I would normally do so, but even if I gave a single dose, I don't know that I would necessarily see that medication is still in effect the next day or down the line. And then also after we would finish, like, let's say the 14-day course, and any weight gain that was had during that period, if the animal is still having that chronic disease, which is very likely, and still eating poorly, they may then again lose weight. So again, this is where it's important to reassess your patients after that course of the medication and determine that we do need to go again and to continue to maintain that weight and the caloric intake.
Yeah, I would completely agree with that. And again, that does reflect what is written in the SPC for Mirataz in terms of reevaluating your case after the 14 days has been passed, and then establishing what is going to be the next best course of action for that individual patient. And yeah, that can vary, can't it, from cat to cat, and really just need that individual case-based decision. So yeah, absolutely. So during the webinar, I suspect, given your expertise, Dr. Quimby, we did receive quite a few questions on chronic kidney disease. So the first one that's up on the screen here is the drug specifically for chronic kidney disease patients, or are there other usages? And the second one is, in your opinion, would you supply all of your chronic kidney disease cats with Mirataz? Is it something you use really commonly?
I think that's a great question. And I, of course, being very centered on chronic kidney disease, didn't mean to give the impression that that was the only thing it was about. We definitely use the medication in all of our patients that are struggling with their weight. So it's not just for chronic kidney disease patients. Of course, many of them have kidney disease. But truthfully, what it comes down to for those patients is that usually at some point in time in their disease, they will be struggling with their weight and their appetite, and will end up getting that medication. So it's very logical to me that it's a big part of my management of their nutrition, which is why I chose it as my primary example in the webinar.
Absolutely. And I think for a product that's licensed in cats with chronic disease, when we know what sort of chronic diseases our feline patients suffer from, chronic kidney disease does make up a large percentage of those patients that are going to walk through our doors. So it is a sensible question, but I would agree with you, especially from a DECRA perspective, that the indication is for helping cats with any chronic disease process. So not just for chronic kidney disease cats from our perspective, but very helpful in those cases. So have you utilised Mirataz in cats with chronic cardiac conditions? Is there anything specific to note in these patients at all?
I certainly do have a number of patients that have a known heart condition, and to the best of our knowledge, we've never seen a concern with using mirtazapine in those patients. The other thing I would probably mention is that a lot of our patients may not have documented heart disease, but it may likely be there, or their heart is suffering under the brunt of several chronic conditions. And again, we've not perceived there to be a problem with the medication.
Absolutely. And that's reflected within our pivotal field trial data as well. Although the majority of cats did have a diagnosed underlying condition, there were a certain percentage where actually the chronic disease was unknown, it was being investigated. So
Hmm.
there's not to say, like you say, that a percentage of those may well have underlying cardiac issues that we just aren't aware of. So yeah, I would completely agree with you there. Have you used Mirataz in lymphoma cases and found it to be of benefit, Dr. Quimby?
So I think that lymphoma would be a good example of a chronic condition where we're fighting weight. And then also there's a lot that the cat is going through. And things like the chemotherapy drugs or other medications that the patient is on for its disease might have an effect on it. So again, anytime that we're having a problem with weight, even something like cancer causing the weight problem, we do perceive there to be a benefit for those patients to be on this medication and just helping them through this process. And part of the management of their nutrition can be really helpful.
Have you used Mirataz in cats with pancreatitis?
Yes, that is definitely a big indication for us. Again, I think that we perceive pancreatitis, I guess I would make the point that we perceive pancreatitis as happening suddenly, but it actually probably doesn't. There's a lot of evidence in cats that it may be a chronic or even a subclinically chronically recurring disease. So once I know that that patient has pancreatitis and the course of pancreatitis might be quite long, even after they get out of hospital, it may be weeks before they're back to normal, we do really feel that it's helpful to help manage their weight, their regain of weight and get back on track. And then this question also relates specifically to nausea. And interestingly, from a theoretical standpoint, there's a possibility that mirtazapine helps with that as well. Like I mentioned earlier, it is a 5-HT3 receptor drug, which is also purportedly having anti-nausea benefits. So for that reason, I think the pancreatitis patient is a perfect indication to be really thinking about their weight and how to clinically help them feel better during that event.
So I hope we get the interpretation of this one correct. My understanding of this is, have you used Mirataz in cases which have had some form of poisoning or intoxication? We'll answer it in that way, and I apologise to the asker if that's not exactly what they meant. They're always more than happy to get back in touch, and we can try again if that's not exactly the question they were asking us.
Yes, I think that, of course, in the moment, I may not actually know what happened to the cat, right? I just know that it's struggling clinically and maybe losing weight and is not eating in that moment. And then whatever happened may take some time, A, for me to do the diagnostics to figure it out, and B, for that animal to recover. So during that time point, I am very much focused on making sure that I maintain the nutrition and the body weight that I want. And that's why in this case or something similar, we would reach for that medication to make sure that we're doing the best that we can from a nutritional perspective. And who knows how long the course of disease in an instance like this would be.
Indeed, and I think that reiterates some of the really important points on the Mirataz SPC in terms of we don't want to replace diagnostics when we're using mirtazapine in our feline patients, but they can be a useful adjunct while the cat is undergoing the bloods and the imaging and everything else that may need to be done to get to that underlying diagnosis of chronic disease. But in the meantime, it can really help in that sort of stabilization period.
Yep, absolutely.
So this is a really interesting question. Is there a time where you wouldn't use Mirataz in a cat which was known to have underlying disease and wasn't eating?
Hmm. Yeah, that's a great question.
So
I
tricky.
think that it has been asked, so I've thought about it some, but truthfully, I mean, again, for any chronic disease where we're struggling, we're very much reaching for this medication. But the only thing that I can really think of, honestly, would be if there was a concern with the ears themselves. So if they were damaged in some way so that the skin was not intact, or the cat had very chronic severe ear disease where applying that might actually cause further irritation because the skin was not intact, then I might be, hesitant to do that and might need to approach the problem from a different way for that specific cat.
So this is primarily a clinical question, again relating to your expertise in chronic kidney disease. So this asker has said that she used anabolic steroids quite regularly in 40 years ago for treatment of her cats. She now approaches patients slightly differently, as you described during the webinar, but is wondering whether those more traditional medications of anabolic steroids may still have a role in our chronic kidney disease patients.
I think that's an interesting question from the standpoint of I do really care about maintaining muscle mass. I think, of course, we know that traditionally anabolic steroids are associated with side effects that may not outweigh the disadvantages, may be worse than the advantages of using them. And it also kind of brings home the point that there are, interestingly enough, there are actually a lot of other medications on the human side and still on the research side being developed to maintain muscle mass directly. But for our feline patients, I would probably take a step back, because usually the reason that's happening is because we're not getting in the calories that we need. We're getting weight loss and we're getting muscle loss because of inadequate caloric intake. So for me, I'm very much paying attention to that first and hitting that as my first aim. And then, once we can say we're achieving that, maybe some additional interesting, medication might come to address muscle specifically. But I'm back at making sure caloric intake is adequate, because unfortunately a lot of times we discover it's not, especially for chronic disease.
Indeed, and I would say that you covered this topic really beautifully within our webinar. So if anyone would like a little bit of a refresher as to how Dr. Quimby addresses the caloric intake of feline patients, do catch back up with that webinar, and you can get the link to that from your local representative if you don't have that to hand. So another really interesting question that we've been asked here is, what if you give Mirataz, if you've administered mirtazapine and the cat doesn't eat? What would you do then?
Well, I think it brings up the important point that not every patient can be expected to respond to the medication. So I will have very seriously ill patients that are in hospital that are honestly not going to just magically, start eating and gaining weight when we give this medication, because it's just not the time to use it. They need a feeding tube. They need additional medical attention. And so that's a very important point. I tend to get a little bit of a sense of the cat that's thinking about it and is a little bit less severely ill, and we're working with their chronic condition. That's going to be that's the patient that I anticipate will respond very well. But that very, very seriously ill patients, like it often doesn't matter in that moment what you do. They're not going to be stimulated to gain weight and eat in the moment with the drug. The other comment that I would make is that it's also important to realize that if your patient was already on Mirataz and they then stopped eating, that would trigger me to recheck that patient and try to figure out what has happened, what's gone wrong, or what has changed for that patient, because it could be that another complication of their illness has cropped up that needs to be dealt with, that suddenly the medication does not seem to be as effective because the cat is now feeling poorer for some reason. So definitely things to think about as you're assessing your patients.
Absolutely. And I think for me, my immediate response to this question was that it raises quite an important point for pharmacovigilance as a wider sort of topic. So I think when we think about an adverse event to a medicine of any sort, it's almost sort of a very negative sort of action or dramatic event that occurs after a medication. We don't often think of it not working as being an unexpected event post a medication. So I would also highlight that in the very unlikely event that you use any medication and it doesn't work, in inverted commas, then get in touch with your local representative and note that down so that that can be documented as part of routine pharmacovigilance. That's a really important point to know. As a pharmaceutical company, we would take all the details and document that for you, so that it can be logged within our systems. So we know that a lot of our cats that are going to receive Mirataz have chronic underlying conditions. That's what it's indicated for, and with that come a lot of other medications. So are there any you would be particularly concerned about, especially in older cats, the interaction between them and Mirataz?
That's obviously an important question because, like you said, we do tend to get into polypharmacy with chronic disease, and I know there are a couple that are on the label, of course, to not use with Mirataz, but the ones listed here in this question, we don't know of any specific concern, and to the best of our knowledge, even in humans where the medication has been used pretty extensively, they have a good idea of what medications don't sit well or interact in some way with mirtazapine. So lucky for us, that's the case. And generally speaking, there's actually very few medications that we would concurrently be giving to our feline patients that would have the possibility to interact with the mirtazapine.
I would agree, and I would always recommend reading the SPC. There are three groups of medications specifically mentioned on there. So I would direct any viewers to that if they are concerned. But equally, if there's a medication which isn't specifically listed on the package leaflet on the SPC that you are concerned about giving alongside Mirataz, do not hesitate to give us a buzz. Contact your local DECRA representative and we will do our best to help you out with that. In our pivotal field trial, which obviously led to authorization of Mirataz, we gathered quite an extensive amount of information on the cats that were on the trial that received Mirataz alongside their current regime. So we do have some information and we can try to help you out. But everything that you've just said there, Dr. Quimby, I would completely agree with.